Let's get to that question in just a second, but maybe first of all, we'll let each of the panelists just quickly introduce themselves, starting with you, Caroline, at home.
Hi.
Hi.
Nice to meet you, Rebecca, and panelists. I'm Carolyn Abraham. I'm a freelance journalist and author. I write often about science and medicine and developments in the field and the social impacts that these developments have. And I write for Globe and Mail, various others, and papers in Canada.
Daniel?
Hi, my name is Daniel Mueller. I'm a professor at the University of Toronto in the Department of Psychiatry. I am a psychiatrist and scientist at the Center for Addiction and Mental Health here in Toronto.
I'm Jonathan Mopetsi, a journalist with CBC Montreal, where I cover Quebec politics and have over the years covered the far right and conspiracy theory movements in Quebec.
Can we bring that poll back up? Is that possible? No? No, okay. There we go. Basically a personal question to you guys and to our people that are joining us from home about how much we felt the pandemic affected our lives. And I guess we can see most people said moderate. Few people said apocalyptic. Jonathan?
Apocalyptic.
Yeah, and 35% of people said severe. I think, looking back on the last 20 months or so, one thing that's really clear is that we were not in the pandemic together. Both, if we look at Canada and if we look at globally, we were not suffering together. We were not affected equally. There were groups in our society and globally that were far more affected by this pandemic and the measures that were put in place to try to keep people safe. And I think the other thing that has become clear is that the pandemic also revealed a lot of inequalities that were already there that maybe were not that obvious to us. So we saw some groups that were so much worse affected partly because of structural and societal issues that existed long before. So I just maybe will start by asking each of you, if you look back at the last 20 or so months since this pandemic started, and you look at the research or the reporting that you were doing in regards to this theme of disenfranchisement, is there something that really stood out to you? Is there something that was really the take home of the pandemic, or something that really surprised you in your research or your reporting? And maybe again, we'll start with you at home, Caroline.
Thanks, Rebecca. Just to pick up on what you said, I think there was a sense in the beginning that we were all in this storm together, but I think it took a while for everyone, politicians, public health officials, collectively to realize that we were all in very different boats in this storm. Mm-hmm. And, there was that, I would say, especially in that first wave, there was this sense of almost sort of novelty that was going on as people, were, if they were fortunate enough to have comfortable homes and be able to stay home, they were, baking sourdough bread and exchanging recipes and, having online drinks with friends and Zooming and so on. And then there was another segment of society for whom that was, not possible at all to stay home. I think we all realized suddenly that our when it came to who were the essential workers, they were the people working the cash at the grocery store and running our TTC and doing all the things that we frankly, I think, value quite differently now or came to. And so I think that was sort of a slow burn through the pandemic. And then by wave 3, when we really saw the numbers spike, it was kind of like our realization came after the fact each time. It was like, I think everybody prepared for the pandemic thinking that, like SARS, the hospitals were going to get hit largely because of the footage we saw from Europe. but it wasn't the hospitals, it was long-term care. And then everybody was focused on long-term care, but actually at the same time that the tragedy was unfolding in long-term care, it was unfolding in the homes, in the lives of all these people on the margins of society. So everything sort of there was a lag in realization.
Daniel?
Well, thank you. Yes, I can speak a little bit on both, I believe, on science and on probably mental health care. And I mean, there's a lot to say here, but in brief, I think that for the healthcare system, we have seen, I think, a tremendous effort, a joint effort, and lots of solidarity. I think, those people working in frontline have done a fantastic job. And again, you can't value them enough, nurses and admin people and whatnot. Doctors and so on, they just took it, right away and said, "This is a challenge. We're just going to be there for you." And I think that was a wonderful experience. On the other hand, of course, this came at a price, at a certain toll. I think many of these healthcare workers eventually got more exhausted and than usual, and it's really also very demanding to wear plastic gloves, plastic masks, and so on all day long, and how uncomfortable it is even for 5 minutes sometimes to wear plastic gloves and so on, and you do it all day long, plus masks on the face. So that was really a huge toll, and people got exhausted. And I think around the time of the second wave, I noticed a lot of exhaustion also around me. And coming to mental health care, because that's what I'm doing, immediately after the pandemic started, we saw a sharp decrease in attendances, of course, in our emergency rooms and so on. People were just staying home because they were afraid of coming to hospitals, also because this is a place you shouldn't be if you want to avoid infections, right? And that has steadily then since increased, and we were always wondering, is there going to be a tsunami effect? Basically, first you see less, and then you see more, in a huge wave of people coming. And interestingly, we haven't seen that wave. We're still not even on a provincial level at the pre-pandemic level of using acute care system, acute care places. Though we are seeing more at our facility here around the corner, basically, but I don't think we're representative for the province or for the country, because we have seen this steady increase over the years before as well. Basically, this is why we're building new. We have these new buildings on Queen Street and so on, because we're just growing. We just have a double demand every 5 to 10 years or so of people coming and asking for acute care. And that's why. That's also due to the population increase and so on, but also that access is made easier. And there's one thing I like to say also: why haven't we seen this increase so much, even though everyone knows that people are getting more anxious and are getting more stressed? There are a few things to say. I think first of all, we're just the tip of the iceberg. We really see those who are severely ill, mostly as a tertiary care center. So we see, we're the tip of the iceberg, and unfortunately, many people are not coming even by themselves. We have a lot of police cars coming in and out because these are the most severely ill people. And luckily, we haven't seen, therefore, an increase in diagnoses from a psychiatric point of view. But we do see the numbers. The ICES, the Clinical Evaluation Services here in Ontario, has clearly shown that since the pandemic, many more outpatient visits with family physician have been made from patients or from population, I think. That means that there is a demand, but probably at a lower level, lower to moderate severe level, so to speak. And that is an interesting observation. These numbers can be clearly seen, and they can also be stratified by postal code and so on. If you want to find more out about inequities and so on, that's great to see. And I think maybe I stop here, because otherwise I'm talking too much. I'm a psychiatrist. I can talk forever.
Jonathan?
So I guess I'll give you something, my perspective from for what was happening on the margins, which I think surprised me. So I did a series of stories about a year ago, so I had covered the far right in Quebec for several years, starting about 2016. There was a kind of a rise in their prominence, and then the far right kind of fragmented, and no one really paid attention to them heading into the pandemic. And then I guess just around the start of the second wave in Quebec, you started to see a more robust movement protesting public health measures. And to my surprise, all these figures who I'd covered in the far right movement were now kind of like had reinvented themselves as public health experts, so to speak, and now we're protesting the steps the government was making. So one, it was surprising for me to kind of see them use the pandemic to reinsert themselves back into the public discourse, and two, what was surprising is to see the alliances that they made with other social groups in order to kind of develop some momentum. And so you saw, so the far right in Quebec traditionally is quite secular, and then all of a sudden you saw them holding demonstrations with evangelical pastors, and evangelical pastors really tend not to be very public at all in Quebec, and all of a sudden you saw them taking a very, very prominent role. And then you saw the kind of more conspiracy QAnon movement, which again, had been completely invisible in Quebec until the pandemic. And so, and then various natural health people kind of joining the movement. So I think one of the things that surprised me was the way that these groups, which before the pandemic had no dealings with each other, how they kind of came together and have now kind of formed a movement of a certain robustness. How long it will remain cohesive, I think, remains to be seen. But I think that was one of the most surprising things for me in covering the pandemic.
Okay. Caroline, I just want to pick up on something that you had mentioned when we were talking before the panel about one of the problems being, and I think this was mentioned in the last panel as well, the lack of data. And the fact that we don't keep health data well based on things like race. And I mean, I don't know if you can talk a little bit about why you think that is, and what problems that causes we try to fight the pandemic.
Yeah, definitely. I was actually working on a piece for a Zoomer magazine about vaccine hesitancy. This was just before the vaccine rollout began, and I was speaking with the African Canadian community in Halifax, and they were, saying how long they had been trying so hard to get health-based data, health data based on race and ethnicity, because so much of what we understand about, how certain visible minority groups or different ethnic groups might be affected by, particular conditions or ailments. A lot of our assumptions are just based on what we see in the United States. There's really been this reluctance in Canada to count, because I think partly for privacy reasons, partly that's our sensibility. But sometimes the impact of that, and I think that's one of the things that contributed, to the toll of COVID in certain groups, is that we don't know the numbers. And it wasn't until there was, some clamoring for it in Toronto, where you started to see, hey, wait a minute here. The majority of people being hardest hit by COVID are, ethnic and visible minority communities. And then as the numbers, were finally collected, that was borne out. And then also in wave 3, I can think of at least a half a dozen interviews that I'd seen on television when, doctors were talking about, how desperately paid days off for work were needed, because the people most at risk were those still going into the factories. And, the comment was most of the people in ICU right now are not white. And, there's I think it's in part just, by culture, we want to, not single out groups, or perhaps we have sort of the wrong idea about what it means to count. that somehow counting is bad. But I think if we as a society collect data on race and ethnicity with those communities, like not on those communities, but with them, you're going to get a lot further ahead in understanding, where the root problems are, and not knowing that prevented early public health interventions, in those communities, I think.
Do either of you want to pick up on that?
Sure. I mean, I wanted to add maybe, or perhaps I should add that, those things are critical. I guess there are some sensitive numbers around there. Let's be clear on that, and it's hard to see from outside, or to judge from outside why and what leads sometimes to this difficulty. I think we should all do a much better job in any institution to be more open and transparent, and to have such data more accessible, because ultimately this is my second hat is research, right? And I like to see data as much as I can, and if they are held back or if they're difficult to access, well, I have two choices: I wait or I do something else. And the reality is, then I do something else. I start another study. There's lots of projects to do, so to speak. Luckily, lots of great projects around there. But those things, those have been critical. And I remember a few years ago, someone said, suicidality rates are higher in the indigenous populations. And again, suicide is the tip of the iceberg again, which tells you a lot. That there must be a lot of underlying factors below. Inequities, poverties, and so on, and that study project was kept on hold for a very long time, and the reason really was that it was critical to do that type of research, to study suicidality in Indigenous people for various reasons. First of all, there has to be a level of comfort on both ends, and perhaps those communities are not happy to have someone coming in from outside, exploring things, and then talking about their issues and their problems from a different perspective, from a non-Indigenous perspective. And I think there was a lot of dialogue necessary here to first start. And these days, it would be different. You would talk to the communities first, have a dialogue, and ask what they want, what they need, and what would they like to study, and then you go back and do your project. But that I think was a learning experience over the past 10 years, and that has taught us a lesson. It's not like even if things are meant well, right? You have to have a dialogue. You have to talk to people, and you have to understand. It's like saying, I know what's good for patients, but do they really want that? Yeah, there's a difference between what people need and what people want, right? So that's I think critical, and I think we can do a much better job. And privacy has very much been a matter also of critical. Of critical value. I think when I talk to and I'm doing a lot of genetic research, and genetic information is sensitive again. And in the past we were having an ethics board which would tell us if we could go on with our research, and that was fine. Nowadays we have to also have a good explanation to privacy officers, and that's relatively new. And there is, of course, always a big concern every time you look into people's data, genomics or genetics or even or clinical or demographics. So I think sometimes it's also meant for a good thing. Sometimes, of course, however, it delays a lot of things. I think the world was just not prepared for the pandemic, as we see in many ways, and I think they were also not prepared to know how to share data, and hope we can learn from that, and hopefully there is going to be some changes. But I guess that has remained a very critical component. Data sharing.
That's really interesting, and hopefully if we have enough time, I'd love to hear from each of you what you think we could have done better in regards to this issue of the unequal way that the pandemic affected our societies. But Jonathan, I just want to pick up on something that you said about your reporting, about you saw these kind of new groups forming, these sort of new alliances that were not traditional in Quebec, for example. And I'm wondering, why do you think that is? What do you think it is about the issues faced in the pandemic that made these groups that had kind of disparate ideas before kind of come together in protest?
That's a good question. Some of the experts I spoke to felt the common thread was anti-authority. So obviously, far-right groups were kind of, opposed to the government. There's a certain libertarian strain to some of them. When you deal with some of the like the natural health movement that ended up being kind of sucked into the conspiracy movement again. I had one expert who described it this way: so these are people who are kind of already on the fringe of accepted science. So they're already kind of see themselves as challenging a vein of authority. Once they enter a conspiracy movement, they themselves can become centers of authority. So I think that's where you kind of begin to get the overlap of those groups.
I think that we're out of time. No, we. One more minute. Okay. Yeah. Maybe just very, very briefly from each of you. I'd love to hear what you think. We could have done better in regards to like making sure that this pandemic did not affect some groups so much more poorly than others. Maybe we'll start again with you at home.
Okay. Yeah, thanks, Rebecca. I think now I'm going to be echoing the previous panel, but I just think that it's 2021 and I can't believe that we have this super slow patchwork system of collecting vital statistics. Like our data on death is months and months behind in several provinces. And so there was just no way of knowing that there were all these excess deaths happening out in the community. People were dying in their homes. There was a spike in deaths in the home as opposed to the hospital during the pandemic, and we missed it. We missed that because we didn't know, because we didn't have the numbers, and people, still are inputting by hand and things like that. So I would say, again, just to echo, if we have the information, we could do better. It can inform policy and interventions, and hopefully avoid, what we saw happen in this crisis.
Do you have a very, very brief thought? I think we need to move to questions about what you think we could have done better.
Well, before the pandemic, we already had an undertreatment, underserving of mental health care. And I think that it has only become more obvious now that it is a problem, and we have a mental health crisis. By the way, the Walrus edition, which is somewhere here, talks about the student mental health crisis at this point of time. I think we just need to I think invest more in the mental health of our citizens.
I'd pick up on something Carolyn said. We need to have a better understanding of racism in Canada. We need to have a better understanding of how precarious labor intersects with class, with race. I think one of the big things about the pandemic that it showed us is that our politicians, our leaders, still, I think, are kind of operating from paradigms of understanding that no longer reflect reality, if they ever did. And I think we need to kind of adapt very quickly to those issues.
Okay. Questions in the audience? Anyone? Wency?
Okay. So Danielle, I have a question for you. You had mentioned that the sort of mental health issues, the great increase in mental health issues are sort of on the moderate level. And I wondered what needs to happen to prevent this from becoming a tsunami of, people on the moderate spectrum of mental health issues becoming severe.
Yeah, thank you. I think the question is, what can we do in order to prevent, people getting ill to the point that they need treatment? Well, I think this is an excellent question. First of all, um, I I guess we have to really take things from a societal and psychological level here and do education and teach people and give advices. So we should have a broad range, I think, of access to information, what to do in social isolation, what to do in times of loneliness and so on, and higher stress levels. And there are good recommendations out there. I usually cite six points or so that I would tell people. Learn about the pandemic. These are obvious points, if you wish, but it's about learning about the pandemic. Communicating. Be active. Don't underestimate physical exercising and so on for your mental well-being. There is communication with others. There is value yourself and value others, and those are important things really that are, I would say, are strengthening the resilience at that point that people can do much better and are not going to need further care, intensive care at least.
I think we have a question from online. Yeah.
Yeah, from the chat. So there's one question online. What was the impact on young people in terms of mental health? Very broadly spoken, but the impact on young people in particular.
Well, it's also not well studied, although, I mean, there are data showing again that overall the level of mental health diagnosis has not significantly increased. But we need to be careful if we say so, because paradoxically, people who are maybe on the anxiety and depression levels, they might get now in a higher risk of becoming even more depressed and being more anxious. On the other hand, we have people sometimes who have severe social anxiety, who might have ADHD issues, and they paradoxically can actually benefit sometimes from not being exposed too much in public, in certain stress situations, certain meeting people. And so there are also a little bit of as it always is in every bad thing there's something good, if you wish. There's also people who might even actually show some benefit. So overall, the impact is probably huge, but it's more happening at a kind of subtle level. But we did not see again increases in admissions, and this is globally. For youth and mental health, for younger, let's say, children and adolescents, which is interesting by itself also.
Questions? Anyone? No more questions? Okay. Well, thank you all for joining us. I think we'll have I think we actually have, we have one more question. I don't know if we can put it up here. We have a question that we'll ask to the audience. No, we don't have another question? Oh, okay. Okay, great. So we'll just switch to the next panel. Great.
All right.